started Text4baby in May of 2011. It's gone beautifully. It actually has been well received by our patients. In fact, Delaware has had the third highest rate of adoption in the nation. Westside is a large part of that population. So I think that our individual patients have really embraced it. On a personal level, I actually have an infant that I signed up for Text4baby, and I've been getting texts from Text4baby just so I can see what the program is like personally. Well, I think that really the idea was taken over by our prenatal team, that they had learned about it. They thought that it would be an effective way of communicating with our patients, and realized that a lot of our patients don't have computers, that it's time intensive to try and reach them by phone on a regular basis, but by using texting we were able to reach our patients in a really effective way. Well, obviously texts aren't going to be a source for a lot of information, so it's really just bullet points about specific things that are important at a given time. The mom, when she signs up for it, puts in the due date for the baby, and then during the course of the pregnancy and for the year after the baby is delivered, we'll receive a couple texts per week about stuff that's important regarding her health or the baby's health. There's always needs to communicate better. I think that there are so many things that we need to tell parents about their pregnancy, about their infants, that it's tough to tell them everything, and if we do try and tell them everything, they're just going to suffer information overload. So by being able to give them small bits of information on a timely basis, I think that we can really give them much better information. One of the things that I like so much about Text4baby is how easy it is. It's really just, you send a text and you get signed up. You get some texts back that make sure that you wanted to sign up. They make sure that it's not going to cost you anything based on your cell phone plan, and then you receive these texts on a regular basis. And it's actually a lot of fun. The information is not just medical. Sometimes it's things like, your baby's 6 months old, congratulations. So it's just a neat way to interact about your baby or about your pregnancy.
I have been here for about 2 years. I'm the prenatal nurse manager, and I became involved once we had agreed to do the program and it needed to be implemented. So I was responsible for educating the providers, the nurses, the medical assistants on the program, and making sure that it was promoted at all sites. We advertise several ways. One thing is we have posters at all the sites in the different waiting rooms. We also have small flyers that we give to them. We do it at prenatal intake visits. We do it when they come to see the social worker, when they come to see the breastfeeding peer counselor, at different support groups and at different programs that we have on site. And we've received a really positive response from the patients. They seem to really like the program. Sure. Very recently we had a teenager deliver. She's 15 years old, and she called to let me know that she had delivered the baby, and she said, hey, I'm still getting text messages to my phone. I think she thought that the program only went through pregnancy. And I asked her what she got, and she said, I got a really good message. It told me how to make the baby stop crying, so it had suggestions for that. So as a teenager, she really appreciated that it came directly to her phone and she was able to use it right away. She called and we had that conversation. I let her know that actually today we would have a parenting class, so we invited her to participate and invited her to bring the baby, and she is planning to come. So I think it opened up conversation about newborn care in general. I mean, our hope is that we'll increase involvement, continue to promote the program so that a lot more prenatals are enrolled. I think we still need to have more new moms involved. And really promoting it at our new sites. We're now going to offer prenatal care up at the Bear and Dover office, so making sure that we're connecting more patients because they seem to be really happy with the program. I think it's a great service. I think it's an opportunity to get everybody involved, from the MAs to the nurses to the providers to the social workers. It's an easy enrollment, like we said previously, and it's great for the patient because it's free. It's accessible, it's on their cell phone, so we're able to target a large population without a lot of resources. So I would definitely recommend using it.